بسم الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين. Good morning, ladies and gentlemen. I'm delighted to introduce to you today a very important topic, which is about dengue fever. How can we suspect such cases? How can we treat them, which is mainly supportive? And I think this is an important lecture for the medical students as well as residents and all my colleagues. Because nowadays we are hearing that there is an outbreak in Sudan, although I couldn't come up to something official, but we are all worried about this, and we have at least to help with this lecture. So what's dengue fever? The epidemiology of this disease is it's one of the common arthropod borne viral infections in humans, and 100 million of cases are found in the tropical areas. 10,000 deaths annually are encountered due to dengue fever. This is the world map, and showing that most parts of the world are affected with dengue fever, but South America, the eastern coast of Africa, including Sudan, is also affected. Some parts here in Saudi Arabia and Yemen. India is heavily affected, as well as the Southeast Asian countries and islands. So this is one of the studies showing that the prevalence is ranging from 31.7% to 56% in the suspected cases, and symptomatic patients, and even in asymptomatic patients visiting the OPD in Saudi Arabia. This research was done in Saudi Arabia, and I think this is a high prevalence rate, but it's just during the epidemic of the disease. I'm sure I have to look it up to see which year is it. And in Sudan, now people are talking in the social media that there is an outbreak in the in the northern parts of Sudan. And I think this is important, and we have to make sure about this. What's the etiology of the disease? The etiology is the vector which carries the disease. The virus is called Aedes aegypti. It's a mosquito that bites people in the daytime. It breeds in the damp water, and it also spreads the Zika virus that we have heard about like 2 years ago. The disease is dengue fever is caused by flavivirus, and the incubation period of this virus ranges from 5 to 6 days. So this is the photo of the Aedes aegypti, and the other type is known as Aedes albopicticus, and both are very beautifully shown up here, although they carry a very disastrous and killing disease. So what are the risk factors for the disease? It's the age, particularly the extremes of age, children, elderly people. There is genetic predisposition also, and the immune status of the patients. And this is the course and timing of the diagnosis. The disease has got 3 phases: the febrile phase, and this is depicted in the red line. The inflammatory response initially from 0 it starts to climb up till it reaches its maximum on day 3. And the capillary leakage, which is very serious, and this is where the bleeding, the shock, and the renal impairment, the end organ failures occur. And this is depicted in the in the dark blue. Then the green line is showing up the immunological response in the form of IgM initially and then IgG lately. The critical phase is the phase that occurs from day 4 onwards till day 6.5. And here, the shock syndrome, the bleeding, the organ failures occurs. And then this is followed by the recovery phase, which starts at the end of the first week and goes on for days. And the clinical features include, the most importantly, the fever, which is indicative of the viremia. That's to say, the replication of the virus in the blood and the presence of the virus and its replication in the blood. And this subsides after 3 days and then recurs later on with more symptomatology in the form of malaise, headache, vomiting, and sometimes uncommon presentations like facial flushing, retrobulbar pain that worsens on movement, conjunctival suffusion, and this is seen in almost all of the hemorrhagic fevers, severe backache, lymphadenopathy, morbilliform rash that starts on the peripheries, that's to say it starts in the limbs and then spreads centrally to the trunks. Other clinical features include the severe forms of the disease that is seen in Southeast Asia and mostly affects children. Mortality rates goes up to 40%. The mortality rate goes up to 40%. And here in this disease, it's much more common to find the capillary leakage syndrome, and patients might present with hypotension and shock, thrombocytopenia, and hemorrhage. And those are, the disease is usually catastrophic, and mortality rate, as we have mentioned, is almost 40%. So how can we diagnose the disease? We need to have a high index of suspicion, and if the disease is always at the back of our minds, I don't think we would miss it. And isolation, the diagnosis then should be confirmed by isolation of the dengue virus and tissue cultures. And detection of the virus RNA by PCR now is available in most of the hospitals all over the world. It's very quick and very much with high sensitivity and specificity. And it's very quick in the diagnosis. Sometimes it takes like just minutes. So this is really one of the most breakthroughs in the investigation of viruses and bacteria. Detection of the virus-specific immunoglobulin M antibodies, rising IgG in the sequential serum samples, hemagglutination tests, ELISA tests are all used. And if you look at the CBC, simple test done in the emergency room before everything, then it would show leukopenia and thrombocytopenia. And this is common to most of the febrile illnesses, like particularly malaria, brucellosis, and more importantly, during this outbreak now, the coronavirus, also in MERS-CoV, it was showing up, as well as SARS, and now it's here in dengue fever. So this is an important differential diagnosis in patients with leukopenic febrile illnesses. Management is mainly supportive. We have to give analgesia for aches and pains, for the backache, for the headache. Of course, if somebody is vomiting, then antiemetics, and most importantly, adequate fluid replacement so that we can avoid the shock syndrome. And in any person who is thrombocytopenic or starting to bleed, then blood transfusion should be ready and handy. And if the patient is presenting with bleeding, he should be admitted to the ICU for close monitoring and timely manner management. How do you prevent the disease? I think prevention is much more important than anything else here. And it's simply eradication of the breeding sites in the dump areas where it breeds. And the mosquito nets are not very much helpful because it's a daytime biter, and education of travelers to the endemic areas. Topical insect repellents might be of help. Those are for further readings, and I hope this talk is beneficial to the medical students, residents, and all my colleagues. Thank you very much, and see you next lecture.